Childhood trauma can have profound and lasting effects on the mental health of adults who experience trauma during their formative years. The Adverse Childhood Experiences A study examines the relationship between childhood adversity and long-term health outcomes, has provided significant insights into the impact of childhood trauma on mental health. The A study, conducted by the Centers for Disease Control and Prevention, CDC, and Kaiser Permanente in the 1990s, investigated the prevalence and consequences of childhood adversity. The study focused on 10 specific adversities, divided into 3 categories: abuse, neglect, and household dysfunction. These adversities included physical abuse, emotional abuse, sexual abuse, physical neglect, emotional neglect, substance abuse within the household, mental illness in the household, domestic violence, separation or divorce of parents, and incarceration of a household member. Each type of adversity was assigned a score of 1, and individuals' ACE scores were calculated by adding up the number of adversities they experienced. This ACE score is a powerful predictor of various health outcomes, including mental health. Childhood trauma, such as emotional abuse and neglect, can significantly impact an individual's emotional well-being in adulthood. Adults who experienced emotional abuse may struggle with low self-esteem, feelings of worthlessness, and difficulties in forming healthy relationships. Emotional neglect can leave individuals with emotional numbness, making it challenging to express and understand their own emotions, which can contribute to conditions like depression and anxiety. High ACE scores, which indicate exposure to multiple adversities, have been linked to an increased risk of developing mental health disorders in adulthood. These disorders may include depression, anxiety disorders, PTSD, and even more severe conditions like schizophrenia. The cumulative effect of multiple adversities can overwhelm an individual's mental health resilience. Childhood trauma can be a precursor to substance abuse and addiction in adulthood. Individuals who experience trauma may turn to substances like drugs or alcohol as a way to cope with the emotional pain and distress stemming from their past. Adults who experience childhood trauma often develop dysfunctional coping mechanisms as a result. They may engage in self-destructive behaviors such as self-harm or risky sexual behavior. Childhood trauma can profoundly affect an individual's ability to form and maintain healthy relationships in adulthood. Adults who experience trauma may struggle with trust issues, fear of intimacy, and difficulty in establishing boundaries. These challenges can contribute to a cycle of unstable or unhealthy relationships. A person's sense of self and identity can be profoundly influenced by childhood trauma. Individuals who experienced abuse or neglect may develop a negative self-image, feelings of shame, and a distorted perception of themselves. Childhood trauma can also affect cognitive functioning. Adults who experience trauma may have difficulty concentrating, making decisions, and processing information. TLTH. One of the key mechanisms through which childhood trauma affects mental health is by altering the stress response system. Individuals who experience trauma may have a heightened and dysregulated stress response, which can lead to chronic stress. Prolonged exposure to stress hormones like cortisol can damage the brain and contribute to mental health disorders. The impact of childhood trauma on mental health is not just psychological but also biological. Research has shown that trauma can lead to changes in the structure and function of the brain, particularly in areas associated with emotional regulation and stress response. Adults who experience childhood trauma, especially those with high ACE scores, are at an increased risk of suicidal ideation and self-harm. The emotional pain and hopelessness resulting from trauma can lead to thoughts of suicide, making it a critical concern for mental health professionals. It's essential to note that not everyone who experiences childhood trauma will develop mental health issues. Resilience and protective factors, such as a strong support system, access to mental health care, and positive life experiences, can mitigate the impact of trauma. However, the presence of multiple ACEs does increase the odds of experiencing mental health challenges. Understanding the relationship between childhood trauma and mental health is crucial for healthcare providers, educators, and policymakers. Early intervention, trauma-informed care, and access to mental health services are vital components of addressing the mental health needs of adults who have experienced childhood trauma. Thank you for watching. Please subscribe and help our channel grow.